COVID-19 also brought mental health issues to the forefront. After the circuit breaker was introduced, we observed an increase in the utilization of mental health services and more calls to IMH's mental health helpline. And that's why we set up the Interagency Task Force on Mental Health and Wellbeing chaired by SMS Janil. The task force has published the National Mental Health and Wellbeing Strategy, which sets out concrete plans to plug existing gaps and to strengthen our mental health ecosystem. We will now translate these plans into action. We will have a bigger focus on preventive care so that everyone can take proactive steps and take charge of their own mental health. We will start young in schools. We will continue to integrate mental well-being into our Healthier SG and other preventive health programs.
With the tiered care model, more patients will receive timely care in the community provided by appropriate mental health professionals such as counsellors. This will allow psychiatrists and psychologists to focus on patients with more complex mental health needs.
We will equip a wide spectrum of practitioners, enhance the overall capability of the community to provide effective support for individuals with mental health needs. General practitioner clinics, the GPs, and polyclinics are important touch points for all of us, and especially for individuals with mental health needs. They are community-based, they are easily accessible, and we know that there's a strong association between physical and mental health conditions. So the primary care service, the primary care doctor, the primary care clinic is ideally placed to treat the patient's physical and mental conditions simultaneously and holistically.
The current generation of young people are expressing more concerns about their mental health than previous cohorts. Many countries have reported increases in suicidal ideation as well as mental health conditions like anxiety and depression amongst their youths. In our strategy, we are redoubling our efforts to better understand the issues that young people face. We need to do more to destigmatize mental health conditions so that people do not hesitate to seek help. And we can do much more to build a society where we help one another cope with life's stresses and are considerate of each other's feelings and carve out safe spaces for them. So I call on all Singaporeans who are passionate about this issue of mental health and well-being to join us in this national movement. Together, let us build a Singapore where everyone matters, where everyone has a place, and where everyone belongs. Together, hand in hand, let us improve the mental health and well-being of all Singaporeans.